Good morning, doctors. My name is Dr. Natalie Murillo and my topic is carotid artery. The carotid artery is a major artery in the neck. It runs from the aorta through the brain. It supplies the brain with oxygenated rich blood. Application in medicine. The narrowing of carotid arteries is called carotid stenosis.
Fatty deposits, called atherosclerotic plaques, can build up inside the carotid artery. These plaques can narrow the passageway of the artery and interfere with blood flow to the brain. This blockage or narrowing is called a stenosis. If blood flow to the brain is blocked temporarily, a transient ischemic attack, also known as a TIA, may occur. When the blood flow is completely obstructed, as in a carotid artery blockage, a stroke can occur.
The treatment for this disease is a carotid endarterectomy. Cons: it is a major surgical process. The doctor will make an incision in the neck, take out the cholesterol plaque, and close up the artery with stitches. Pros: there are new minimal invasive techniques for this process. Issue applied in Ecuador.
There's newer minimally invasive techniques, which is what the carotid stenting procedure is, and that's a procedure that I do. And in that procedure, we puncture the femoral artery in the groin under local anesthesia, and then under x-ray guidance we pass little tiny catheters through the bloodstream up into the carotid artery. Now, the first step of the carotid stenting procedure is to place a filter in the carotid artery on the brain side of the carotid artery. And that filter will still let blood continue to flow to the brain during the procedure, but if any particles break free during your intervention, they'll get trapped in the filter. So after you put the filter in, the next step is to perform an angioplasty, where we put a balloon in and stretch open the narrowed area of the carotid artery. And if any particles break free, they'll travel with the blood flow and get trapped in the filter, stopping before they reach the brain, so you won't have a stroke. This next step is to place a stent, which is a tubular metal scaffolding that will stay in the artery and hold it open. The body will cover the stent with a thin tissue over the next month or two, so that it won't be a bare metal stent anymore, but it'll actually have some healed tissue. Following the stenting, we go in angioplasty with a larger diameter balloon and really stretch the stent open. And then the final step in the procedure is to go retrieve the filter and pull it outside the body, along with any debris which was unintentionally trapped in the filter during the procedure. And then we'll just put some pressure on the femoral puncture site and observe the patient afterward.
Unfortunately, this new technique has not been used in Ecuador.